We are thrilled to be here today to talk to you about how to deliver exceptional consumer experience in this new world of healthcare consumerism. About 8 years ago, I came to Silverlink, having spent my entire career at companies like General Mills and Gillette. And when I first came to Silverlink, I was so excited to talk about consumer engagement and experience. And really, back then, it was but a whisper, right? Everybody knew that it was coming, but there was just much more immediate things to tackle in the meantime. And so now, fast forward 8 years, and with the ACA, it's become mandatory and it's become immediate. We are finally in the consumer business, and consumers can vote with their feet, right? So what does that mean? Well, it's both a challenge and an opportunity. The challenge is, how do we individually and collectively in this room transform our organizations and what we've been doing to become truly consumer-centric, right? How do we think about, from the moment they're thinking about evaluating what benefits to buy, all the way through enrollment, welcoming, and ultimately to retention? How do we make that experience relevant, integrated, cohesive, and above all, delivering value that's meaningful to the consumer, right? And yet it's an opportunity. Why? Because the ones that do it correctly will win. And I always say, I feel like in branding, healthcare has an opportunity to have stronger brands than any Nike or Apple or anyone else out there. Why? Because our health hopefully means more to us than our sneakers, our iPhone, and our flat screen TV. So really, there's the opportunities there, and with this, with October 1st, it's now ours to take. And so I can't wait to see 5 years from now who these leaders are that are just bigger than Apple and have stronger trust and loyalty. And the bonus of that is not only do you get better retention, but you also get more trust to ask consumers to make those hard decisions with you and to do the healthcare things they need to do to help stay healthy, but also help all others, lift the ship. So people always say to me, how do you start? Well, again, my mission is to bring the best of consumer marketing methodologies to healthcare to both build brand and drive behavior. So just think about a few things as we walk through the panel. One is segmentation, right? In order to get relevant and personal with people and really hit them on what's important to them, we want to think about segmenting our audiences whenever possible. I love giving examples from my old world because it just makes it so easy to grasp and digest. And, even at Cheerios, we're talking to moms about buying cereal. Well, we talk to moms with new babies. It's their first food. We talk to moms whose husbands have bad cholesterol, and we'd say, do it for your husbands. And we talk to moms with school-age kids who want less sugar. It sounds so rudimentary, but those same things are happening in healthcare, right? There's different reasons we don't get our colonoscopy or our mammogram. And so we have to really reach those people on what they're thinking about and what their barriers are. The second is this explosion of channels. So the good news is there's so many different ways we can reach consumers, right? But the bad news is, how the heck are we going to reach them with so many different channels to have to go after? So again, it's transforming your thinking to really think consumer-centrically. So things like capturing preferences. How do people want to be communicated with? Integrating those channels in a way that we're really thinking about the sequence and the frequency of how often we contact them. And then finally, data. We have so much data in healthcare. I used to say that I would kill when I was a Betty Crocker for the level of information about my consumers that healthcare has. And so what's great about that is we can really make this a personalized, relevant experience and deliver value to our consumers. We used to say at AT&T Wireless, the most love you have is the day they get their new phone and they initiate the cell service, and then it's yours to lose after that. So that's wise words. And to add to that, at Digitas, we tested choice for years. And for the most part, choice depresses, which is counterintuitive. We would give Home Depot gift cards for people that signed up for wireless phones. And we felt like, all right, not everyone, especially, if you think of stereotypical gender division, will offer an Ann Taylor gift card and a Home Depot gift card that the entire population can choose from. Over and over again, it depressed response versus just offering the Home Depot gift card. Because to John's point, now it was a two-stepper. I have to make a decision on the gift card first and then the decision on the phone versus just the decision on the phone. American Express feels the same way about onboarding. If they don't capture the member's heart and wallet in those first 3 months, the likelihood to churn is very significant. So those early first impressions are critical. When have you been delighted by a recent customer experience? And I'll share my own first. Normally when people ask me that question, I always go to Disney because I've got two girls, and anytime we've gone to Disney, Disney knows their birthdays, who their favorite princesses are. You know, they roll out the red carpet, and it's such an amazing experience. We always are left wanting to go back. But I was actually recently delighted by my health insurance plan in the last few months. About 8 months ago, my oldest daughter broke her leg, and it was rather traumatic. I was by myself with her, and I had to drive 3 hours from a mountain to get her to Children's. And 8 months later, when she was completely healed, I called my insurance company for a completely different reason. And the member services representative said, "Hey, how's that daughter with the broken leg doing?" And I was so, I just felt warmth in my heart that, oh my gosh, not only does she know who I am, I'm not just a number, but she actually cares. She wanted to close a loop and make sure that everything turned out okay. So for me, it was just such a great experience that I have a different feeling around my health plan these days.